You're listening to Health Professional Radio with Wayne Bucklar. My guest today is Dr. Michael Freeman. He is the Principal Dermatologist at the Skin Centre and an Associate Professor at Bond University. Michael, welcome to Health Professional Radio.
Wayne, thank you so much.
Now, Michael, I understand there's been some research about a vitamin B3 derivative and also maybe some misconceptions that you can help clear up for us.
Absolutely. The team from Sydney University, Diona Damien and Dr. Gary Halliday, have been working for some years with nicotinamide, as you say, a derivative of vitamin B3, and showing that it stops the immunosuppression from sunlight in the skin. Now, recently, one of their PhD students organised a larger trial, which has just been published in the New England Journal. It was over 300 patients, placebo-controlled, showing a good improvement in skin cancer incidence. So there was a 30% reduction, for example, in squamous cell carcinoma. Mm-hmm. Now, this is pretty revolutionary for a vitamin to be able to cause this sort of improvement in skin. The nicotinamide, it was 500 milligrams twice daily, is a active form of the B3, which is known as niacin and nicotinic acid. Sadly, those two products in those sort of doses cause significant flushing. They will also be found, the niacin, for example, in foods like beer and Vegemite, but the dose is too low and not significant to be able to help the skin in this way.
Yes, it sounds like if you're not going to eat buckets of Vegemite, to get 500 milligrams is going to be something that you're not going to find easily.
It would take 4 small containers of Vegemite to get 1 dose. I don't think even you could stomach that.
Maybe for a day or two, but after that.
Well, think of the salt load. Poor kidneys.
How much beer can I have to go with it?
Oh, you'd have to swim in an Olympic pool. I don't think you could do that either. You might drown in your...
That's challenging now, yes, all right.
Yeah, so it would be very challenging.
A tablet might be easier.
I think much easier.
Now, that was... Did you say it was the number for this was 500? That's a big study.
Yes, it was a big study. It's quite large, placebo-controlled. It was multi-center, and Blackmores supplied the B3 for them, and it really did have a great power. So the p-value was like 0.001, which is highly significant. I've been trialing it since Diona told me about this for the last 3 or 4 years, and I think I can confirm that on average I get roughly a 30% improvement. You'll find that the SCC was the highest with 30%, BCC was 20%, and solar keratosis was only 10% in their study that they found. But it was still well and truly enough to recommend it for our adult patients. Yeah. I think that children should probably not take this. It's not been trialled, and it's really to prevent the damage coming out. For the children, it's all about preventing the damage in the first place.
And Blackmores do a lot of this kind of intensive research-based, tier 1 publication on some of their products, so it's nice to see them investing in some of this.
Absolutely.
So with your patients, it's just one, this is a tablet or a capsule, twice daily, and that's it?
That's it. And specifically, if you wish to reduce the dosing, it's important when they're outside, so that if they were an office worker 5 days a week, they wouldn't need to take it at all.
All right. So it actually does have some relationship then with sunlight.
Yes, absolutely. So what it does is it speeds up the DNA repair, and so that it's essential to have on board when you're being exposed to sunlight.
I am always intrigued, Michael. I'm not much of a clinician at all. I was 40 years ago a nurse for a brief period, but I'm always surprised at how often we're seeing complementary medicines become mainstream. It's kind of like, what used to be a wives' tale. There's an academic study, and all of a sudden it's everything from fish oil to now the B3 derivatives. It's mainstream treatment.
Absolutely, and I think that you'll often find that if something is steeped in history and tradition and passed down through the generations, there's often some good reason for it.
Yes, it looks that way. Michael, thank you for your time today. If you've just joined us, I've been talking with Dr. Michael Freeman, Principal Dermatologist at the Skin Centre. Now, Michael, I think I've got your website here as skincentre.com.au for anyone who's looking to get in touch.
Yeah, I think, look, I would, just for your clinicians, it's so important if they're recommending it to the patients. The patients will say, oh, look, I want some B3. The chemist will say, as they often do, look, which B3 have I got on the shelf? Yep. Oh, take this one, it's just the same. And sadly, it's not. The nicotinic acid, the niacin, will both cause them to flush like lobsters. They'll get very uncomfortable, may even collapse, and of course be very upset with the treatment. So very important to have nicotinamide recommended for the patients, and that we stress on our website.
Yeah, and I guess if that was the what was used in the trial, it only makes sense that you stick with that.
Exactly.
If you just, as I say, if you just missed my conversation with Michael Freeman, you can catch up on his website at skincentre.com.au or on our website at www.hpr.fm. There's a transcript of this interview. There's also a SoundCloud archive and a YouTube archive, and links to both of those are also on our website. You've been listening to Health Professional Radio with Wayne Bucklar.